Let me ask you, what are you self-conscious about?
I'm very self-conscious about the scar on my forehead. I'm self-conscious about my appearance. And I'm also self-conscious about what people think about me. Honestly, I'm not gonna lie. I think the biggest thing is because, well, my forehead is a scar, and I always like had that, and like it was worse when I was younger. So as a kid, I grew up people saying you got a 7 on your forehead, haha, like laughing. So of course I'm gonna be self-conscious about that. Another thing I'm self-conscious about, I think my appearance, because I grew up in a predominantly white area, and I was black. So as a little black girl with hair that wasn't like perfectly straight, with lips that aren't small,
Right.
a big nose and dark skin, and like not having those features that, you know, in that area is considered beautiful, you're always gonna feel self-conscious like you're not good enough, or you're not pretty enough. And I have that, like I have felt like that. I have feel like I'm not attractive person. I remember sometimes when I would just be like, I would do something to make myself look pretty, but it's more I was doing stuff to be equal to a white person or equal to a certain look. I would try to change myself to look a certain way where, you know, like, how do I say this? I would love my hair straight, and I want my hair a certain style because it looked similar to the white girls in my school, but that wasn't me. And I feel as though I was always trying to be like someone else other than myself. And I feel like I had to get out of that area because I had to see that black is beautiful, because I never thought black was beautiful. And the funny thing is, like, when I was in that area, I thought it was such a compliment when people said, oh, you're so pretty for a black girl. I was like, oh my God, that's amazing. I love to hear that.
Wow.
And now I hear it, I'm like, that doesn't sound right. I think that's ignorant of what you said, because your mind changes over time.
Yeah.
I remember one time, I remember someone telling me I had nigga lips.
Oh my God.
Yeah, so it's like those things you hear and you're like, oh, you got nigga lips, and they'll like put their like mouth out, like their mouth out, and you're like, oh, ha ha ha, you're like laughing it off because that's all you hear as a kid. You grow up that way, you know?
Oh my God.
So yeah.
Okay. If you were a facial expression, what would it be?
I don't even know. I think it'll be like, what the fuck? I feel like I'll just be like a whole hot mess, because I feel like a hot mess half the time. Like, I don't know what the hell I'm doing with my life right now. I'm 25. I'm still trying to figure out what the hell I want to do. Like,
Well, you just got your master's.
I know.
So
and I still sit there.
let's put that out there while you're saying, I'm 25 and I don't know what I'm doing. You just got your master's, and the test that you're about to take is for your RN.
Yeah, I have an MSN, and I'm gonna be a RN.
And that's huge.
And the thing is, like, sometimes I forget. That's the crazy thing. So, I like yellow just because there's some sunshine, because there's good things going on. I sometimes forget how much of an accomplishment that is. I forget, because I sat there and someone told me, like, I remember I was with my therapist, because I went to therapy, and I was with my therapist because I had really bad anxiety during nursing school, to the point where I would like have panic attacks, or but you can ask my mom, I would call her crying, like, I failed a test, like, I don't know what the heck I did, blah blah, freaking out. So I had to go to a therapist, talk about things, get things off my chest, because I kept a lot of stuff in, and I had to kind of like get a lot of things off, because I had a lot of anger for no reason. I think that's also why I may have came across as a mean person, because I had anger, and I had to talk to a therapist, get those things off my chest, and talk about things that bothered me as a kid. But where was I going with this? What was we saying again? I forgot. We were talking about
Just the fact that.
Oh yeah, he asked me. He was just like, "What is one thing? Tell me your accomplishments." Because honestly, I always see the bad, and I don't see. I'm always like, I gotta do this, I gotta do that. I don't see all the things I'm doing that are great, because honestly, growing up, my parents always pushed us to be very, like, how to say, goal driven, and also how to say this, like, be like goal driven, and like also just kind of like being independent, and like, you know, one of those people that just like go for everything, like not just be settling for just whatever, being mediocre, like do, like, always do your best, like always put your best foot forward, do what you want to do, be successful. My parents always pushed us that, and I think around the lines when they were pushing us that, they kind of forgot, like, you know, those parents who had like, oh my God, you tied your shoes, accomplishments. I don't think I got that as a kid.
So there were no like claps or good jobs.
Exactly.
It was just like
and
you're doing what you're supposed to do.
Exactly.
Yeah.
So it's like you're doing what you're supposed to do. Like I'm happy, and then like also it's just like my parents never wanted one of us to feel, wanted me and my sister to feel as though like one is doing better than the other. So we never had our time where we had a moment where our parents just glorified that one person. It was always like if they glorified one person, they glorified the other person for something that may have happened a week ago. You know what I'm saying? Like they always made sure that. I think it's like their way of making sure that we felt as though one is not better than the other, that they loved us all equally, but it's like they wanted to make sure it was like something where I think it also was a flaw because even though I had did something good, but my sister was also getting glorified, so I never had a time where my accomplishments were shining on its own, where I could feel good about, okay, I did this. So yeah, I was in therapy and they asked me, what is one accomplishment that you can say that you feel as though is great? And I sat there and I didn't know. I was just like, I don't know. Like, I don't know my accomplishments. And they were like, he sat there, he's like, you're 25 with a master's in nursing. And he's just like, that's an accomplishment right there. And I was like, but in the back of my head, I'm like, I feel like a master's is like, okay. Like, that's not good enough.
Wow.
Like, I need to do more.
But yeah, I feel you. I definitely feel that.
Like, it's just like where you're like, I need to do more. And like, I'm not where I should be at. I'm not sure where I should, I feel like I'm slacking, like I'm not doing what I should do. So you have those things where you're kind of like, oh yeah, like I have a master's, and people always ask me how do you feel with a master's, and I'm like, I don't know, it's a master's. Like you don't see those, like you just be like, I don't know, like it is what it is, right?
Right. What's the most challenging thing you've gone through?
I think the most challenging thing I went through is probably nursing school. I'm not gonna lie to you, when I applied to nursing school, I didn't think it was gonna be as hard as it was. And it's hard as shit. I'm not gonna lie to you. And then, like, the thing is, like, people, and another thing you're gonna go through with nursing is that people, like myself, before I got into nursing school, are always gonna, like, downplay nursing because they don't know what exactly we learn or what we do. They think we're, like, people that just clean up and wipe ass, which is not true. We barely do that in the hospital now because we get so much responsibility. And there's different type of nurses. There's the LPNs who are where the RNs have to delegate to the LPNs, and then the RNs also have to delegate to the unlicensed people, like the techs and patient care techs. Those are the people who usually like we have to be in charge of. So it's not just in charge of the patient, but we also got to look over like 2 other people. We also have to chart, and a lot of times people don't understand, like if you're nurses, if you don't got a good nurse, like a good nurse can save your life because
for sure.
Nurses are at bedside 24/7, and doctors at the bedside maybe an hour out of the day. The person who's gonna pick up you having increased heart rate and having increased like breathing, and the person who's gonna pick up like any abnormalities about your like cognition is gonna be your nurse. And a lot of times the nurse is the person calling the doctor telling them to get their ass over because there's something going on. And a lot of times the nurse is the one recommending that, hey, I think we should do this with this patient, and the doctor usually is like, oh yeah, that makes sense, let's do it. A good nurse can save your life. And I think people forget that, how important a nurse can be. And I didn't know that until I got into nursing. Because nurses play a vital role in healthcare. They're like the glue. They literally, whenever a patient's in the hospital and they have to go to the radiology, or they have to go to dialysis, or they have to go somewhere outside of the unit, they're not calling the doctors and coordinating the care. They're calling a nurse to be like, hey, I'm picking up your patient to take them to radiology. The nurse is going in the room, getting that patient ready and sending them off and making sure they're good. The nurse is getting that call every 5 minutes about a patient who's like has to go somewhere, or who is going through something, or getting that alert that, okay, our patient is going to VTAC. Like that nurse is a person who's going to be catching those little flaws or catching those things to contact your doctor, be like, hey, I need this prescribed now so I can get this to the patient.
Right.
And people don't understand that, and that's something that's going to be hard because I have own people in my life, even family members, who still kind of downplay nursing, and it's like just ignorance.
Wow.
Yeah, I remember one time.
Probably because of like Grey's Anatomy.
It's Grey's Anatomy, and they think that doctors are the ones doing that stuff, and it's actually the nurses. Like, and I literally sit there and I'm like, nurses literally do a lot, and they don't get half the treatment that they should, or half the recognition they should. We get a nurses week one time, but OT gets a month, PT gets a month, but nurses get a nurse week. When we're the ones at bedside with you guys 24/7, giving you guys the care you need, making sure you guys are good, being the person with your family, comforting your family through this hard time.
Can I tell you like a really I don't want to call it ignorant, but like I never knew how this all worked.
Yeah.
So for a very long time, I thought that nurses were the step before you become a doctor. Like I didn't know that people, like now I know, but growing up, like I genuinely thought that like you're a nurse for like that's your training and then you're a doctor. Like when I found out that people go to school specifically to be a nurse and like be a nurse, like and then they're just nurses.
Yeah.
Like because that's what they chose.
Mm-hmm.
Then that's what like changed my whole outlook like on
the healthcare system.
Yeah, and just the whole like job as a whole, because I was like obviously they're doing way more than I thought they were doing, because I was just like the person you were talking about who thought they just like gave the shots and did the band-aids and like
Yeah, and a lot of times nurses are the ones doing the care management. Nurses are the ones that
nurses in and I'm probably gonna sound so stupid, are they in ambulance?
Those
like,
are EMS, so they're like
okay.
trained differently. But there's nurses, like nurses literally can do anything. Going into the profession, I learned so much. Like there's nurses that work in government that do policy advocacy or do policy regulations, like basically do that. There's nurses that do IT, like there's nurse informatics, which is an IT for nursing, and they work within the hospital and working on different things that like IV pumps or making things better so they can flow better in the healthcare system, or seeing flaws within like the IT systems, like even like just like EMRs, like electronic medical records. Nurses can work on that and be like, all right, there's a flaw here, we need to fix this. So IT is an option for nurses. Nurses can go into healthcare management, like I don't have to be bedside if I don't want to. There's nurse practitioner, where you could be your own provider, like basically a doctor. So a nurse practitioner is basically a nurse trained, is a practitioner that's trained, that was a nurse, and they got either their doctors or their masters, and they could be their own provider autonomously from a doctor. They don't have to work under somebody, so they can have their own caseload, they can have their own patients and be a primary care provider, or they can be in the hospital being just like a doctor. It's just that they're a nurse practitioner.
So what kind of nurse do you want to be?
I will be a nurse practitioner. I probably will be my own provider. I think I'm going to work in a hospital because the money's there, and I think I like it. I actually accepted, depending on if I pass this exam, I actually accepted a job in oncology.
Congratulations.
Yeah, so I'll be working with cancer. I'm going to use my knowledge and skills to kind of fight
Miss,
the battle.
I don't know what I'm doing with my life. Like,
yeah, so I'm definitely going to use my skills to basically join the fight against cancer and like help with that, and like kind of like just be there, because oncology, I think, is often overlooked in the nurse world, because a lot of nurses want to go in ICU and ER.
Oh, okay, that makes sense.
Just because it's more intense, but they don't know that oncology is very critical, because your patient can get chemo and they're having an allergic reaction. You got to figure out what to do with them. So we get like people who, a lot of times, because healthcare system's going more outpatient, they want these people to be more get treatments outside. So if a patient comes into the hospital, that means they're in critical condition. Like this patient is literally like either on death row, or they're like there's something going on with them serious where they need 24-hour care. So I would deal with people who are like, who have cancer, who are like either terminally ill, switching over to hospice, or switching over to DNR or DNI. Like, no, if they pass away, I can't save them. Those type of people, people who are on like their last resort of chemo, who had a bad reaction on the outpatient, who needs to come into us and get 24-hour surveillance. So I'll be dealing with those type of people. But yeah, like there's different types of nursing you go into. There's traveling nursing, which is great because you can like go to different hospitals across the whole United States or in different countries and work as a nurse, and they pay for you to do that.
Well, God bless you, because I don't know how you're not scared of the germs.
I'm not.
Like,
I think about
that's all I think about when I think about hospitals is like
the
don't
germs.
touch me. I don't want to see any body fluids. I don't want to be here.
Yeah, and the thing that's crazy is that there's a lot of when you become a nurse, you actually see things a little bit different through a different lens. You kind of see things where you're like, this is germs. Like I remember one time, like I'll be outside, or if I'm out somewhere and I'm about to eat dinner, I have to wash my hands before I even touch a plate. Like I cannot sit down and just eat, or just sit down like from outside and just eat. That's not me. And I feel as though there's people who do that, and I'm like, you're disgusting. Like what the hell are you doing?
Yeah.
You know? So there's different types of things you pick up as a nurse. You just kind of become more germaphobe. Like, I'm very germaphobe on certain things. I'm not just gonna like sit on sit on certain toilets. Ugh. Even if it's like,
no.
I can't do certain things. Like, I was like that beforehand, but it just got worse when you become a nurse.
Mm-hmm.
I remember one time I was actually drawing blood, and it was just recently, and I
God.
accidentally poked myself with a needle that already went into somebody.
Were you so scared and terrified?
I was freaked out because I was like, does she have HIV?
Oh my God, I know. That's what I was thinking.
So I was just like, oh my God, does she have HIV? I was freaking out. So the great thing about the hospital, they have protocol where if I did, since I work there, they basically test that patient immediately for HIV and AIDS. And then I'll get a report back saying like, okay, she doesn't have it, you're fine.
Would it show that quickly?
It'll be, yeah. So they have a rapid, which is like, you'll get a rapid within an hour. So they'll take the blood from the person, and
oh my God, how was that hour for you?
It was like, crucial because
scary?
It was scary, but it was also scary because they were testing for hepatitis too.
Oh, okay.
So like to make sure that I wouldn't get that. So they test for everything, which is great about being in the hospital. They're very precautious because they don't want you to get sick because that's money out of their pocket.
Mm-hmm.
So they're gonna try any way to keep you kind of healthy. But yeah, like, I definitely understand where you're coming from because I freaked the hell out when I like stuffed myself with a needle that already went to a patient.
You have to be careful. Please be careful.
Yeah, I am. Don't worry. But
you literally just gave us a whole nurse lesson.
yeah, so it was like scary. So don't do that again. Like, always put the safety on. I totally forgot to put the safety, and that's my fault. But yeah, it's just crazy things that happen. What else is there?
I was literally gonna ask you. That's the next question. What's the craziest thing you've ever seen?
Oh, I saw someone die.
Oh my God.
And I saw someone die. I saw people fight in the hospital, like, because people get emotional. I think the crazy thing was probably for me was the death, because that was my first death I ever dealt with, and I had to bag and tag them. I don't like talking about it. Because it's kind of like that point where you kind of take the person out, like, they're not a human anymore, they're just a body. And I had to, like, wipe them down, clean them out, get all the drains out and tubes out of them, and then put them in a plastic bag.
Did that mess with you for a little bit, or did you just get over it? Like when you got off, you were like, cool, like another day, another dollar, like.
I think you're always gonna remember your first one because it's definitely that moment where you're like, okay, this is different. Like it's not, ooh, crap. It's different because it's not like when don't work in the hospital and someone dies, you see them in a casket, you still kind of see them as a person.
Yeah.
I still get that feeling with people, especially if I knew them beforehand. But with patients, if they die, it's kind of like those things where like, it depends if I really worked with him a lot or if I didn't. And luckily I didn't really work with that patient that much, and he was already kind of like having like he was on his last. He was to the point where it was happening. Because his breathing was changing. It's called death rattles, and he was having that, and it's one of the things where you kind of prepare yourself this is going to happen. But they have at hospitals things like where they have things where you can kind of like go. We have a lot of spiritual rooms. A lot of hospitals will have spiritual rooms, so if you really have to talk to someone or just sit there and take it out, you can go to a spiritual room, which is usually for religion purposes or just your own spirituality, where you can kind of like sit there and just decompose and figure things out. And they have people there. The one thing I do like is that a lot of hospitals, they have a policy. So if you have to deal with someone who died, you're gonna have to you can't do it by yourself. There's always two people in a room, so you're never doing it by yourself, which is good, and you're never alone. And it's always like either another nurse with you who's helping you through the process, or it's like a tech who's like your tech that's working with you for that day. It's gonna help you through the process, and it comes to a point where it helps you get through it a little bit better, so you're not alone doing it and like thinking about this is a person, he's dead, I gotta put him in a bag, like, and you gotta tag them, like it's not great, trust me. But
that sounds so scary.
Yeah, it is scary.
But you're made for it.
Yeah,
I can do it.
Because honestly, I'm not gonna lie to you, as a kid I was petrified of death, and I don't even know how I got into nursing, but I like nursing. And then when it happened, I thought I was gonna freak out. Only thing that freaks you out a little bit is like if their eyes don't close.
Oh my God.
You're like, can you close
your eyes? And then you have to do it, right?
You have to close
it. Oh my God.
Yeah, so I'm not a real big person with closing eyes, so I haven't done that yet. Luckily, when I first dealt with my first death, the other person closed the eyes, so I didn't really have to bother it. But you're looking at this person, and they're like cold, and you're touching it, and you're like,
Oh, so like the cold thing is like true, like
yeah, the body goes cold after
immediately.
Not immediately, within like a couple hours, and the body just decomposes. Everything just kind of comes out. Yeah, so those are things I'm gonna deal with.
So since you're not scared of death anymore, what are you most afraid of?
I don't know. I think most scariest thing will probably be, for me, is going to be an error. I think the scariest thing for me is me fucking up on somebody and they're my patient, and it's like could put it in like a death or life situation. I think that's the biggest thing for me. Is like I'm actually really scared to take on my first patient alone as a nurse. Right now, like I haven't done that because I've been in school, so I always had a preceptor who overlooked me and like was like kind of there as like a guidance. But it's gonna be, I'm very scared. I'm not gonna lie. Right now, my scariest fear is just like when I get my first patient and just making sure that I keep them alive. So yeah, I don't want to mess up, but yeah.